there are things that we can catch via telemedicine that we can't catch in clinic. So for example, these pets that we can't put hands on, we can actually get an oral exam done because they're at home in their own environment. We have found oral masses on cats and dogs. We have found foreign bodies in the roof of the mouth because the pet was calm enough for us to be able to walk that pet parent through the entire digital physical exam. And so there's those aspects of it as well, of actually being able to put hands on things that we could never actually do in clinic. The other are the behavioral catches that we know that our patients, especially cats, can hide things like none other. And so we actually get like real lameness exams on cats.
Yeah.
Like actually see a cat limping.
Welcome to the Call the Vet Show, the podcast that helps pet parents understand and optimize the health of their furry family so they can live the full and happy life you want for them. And here's your host, veterinarian Dr. Alex Avery.
Hello, kia ora. Welcome to another episode of the Call the Vet Show. I'm veterinarian Dr. Alex. I'm your host here. If we've not met before, I'm delighted for you to be joining me, for me to be sharing your earbuds with you and spending some time talking all about pet health, which is clearly something that I'm super passionate about. Today, I'm also talking about a topic that I believe strongly about, and that is accessibility of veterinary care, of pet health information, so that no matter where you are, no matter what your means are, you do have access to high quality information that will be actionable and will benefit you and your pet. And join me in today's conversation is Dr. Charisse Roth. Now, she's very quickly become one of my favourite people to speak to. I connected with her first in the Dog Allergy Summit, which I hosted a couple of months ago. And we dive deep into the world of telehealth, telemedicine. If you don't know what that is, it will soon become very clear. And we dive deep into lots of different tangents. So we talk a lot about this accessibility. We talk about why waiting times are so high at the moment for taking your pet to the veterinarian in the traditional manner. We talk about that from a pet parent point of view, but also from a veterinarian, technician, nurse, reception point of view as well. And we dive into lots of these different tangents that I know you're going to find super interesting. They're definitely relevant, and there are going to be some top tips to make sure that not only does your pet get the care that they need, but they also get it in a manner which is most appropriate and accessible for you, while at the same time potentially saving you from expensive trips to the veterinary clinic when they're unnecessary. Now, before we jump into all that, if you're not subscribed already, I'd encourage you to hit that subscribe or follow button on whatever podcasting app you're listening to this on. And just to go with the theme of optimizing for health, I'd also encourage you to check out my free healthy dog and healthy cat checklist, which are the key things that you need to know to prevent the most common diseases, illnesses and injuries that I see every day in the veterinary clinic. Believe you me, these are so common, and in the vast majority of cases, almost completely preventable. You can check those out and download those for free by going to ourpetshealth.com/healthy pet checklist with a hyphen between those last words, which makes it a little bit complicated. So I'll leave a link in the description to the podcast and in the show notes as well. So check out that free guide. Make sure that you're subscribed. And without further ado, here is my conversation with the wonderful Dr. Charisse Roth.
Here's this episode's expert interview.
Dr. Charisse, it's really great to be talking to you on the podcast after kind of chatting in kind of different avenues over the last few months. I'm really excited for the conversation that we're going to be talking about today, which is all about telehealth. But before we dive into the nitty gritty of that and what actually telehealth is, I'd love to know just a little bit of your background and how you came to be working in this field in particular.
Yeah, absolutely. So I grew up in a place that I'd actually never met a veterinarian until I was in my third year of college. And so it was not on my radar as a career path. I was actually a biochemist and then happened into veterinary medicine because I was working on animal research models. Went to Texas A&M for veterinary school. As soon as I came out, I was immensely broke and needed to work. And so I came out as a GP and was working general practice during the day, ER overnights. And that was actually really fun. I learned a ton about how to be a great clinician, how to be confident in the choices that I was making. And it was really fun up until I was about 8 months pregnant. And then immediately not fun at all. So stopped that. And during that process, while I was pregnant, I was actually learning orthopedic surgery. And I was in an area, I lived in Albuquerque, New Mexico, and the area that I lived in really didn't have any non-specialist options. And there's certainly, just based on socioeconomic status, there was a need for someone that could say yes to procedures, do it well, but not necessarily charge what a specialist would have to charge for these procedures. So I learned orthopedic surgery while I was pregnant and came back and had my first one on the books as this person exited my body. And what we started to realize is that as I started, building that side of my practice, I was doing surgery in multiple locations and really not able to do the level of follow-up that I wanted, and being able to continue to follow out these cases so that I learned what my outcomes were, learned how to connect with these pet parents. So I started using telehealth as a, hey, record a video of a week out, 2 weeks out of FHOs or doing tibial tuberosity avulsions, all of those sorts of things to really learn what does healing look like, when does the pet parent need me the most. And I just realized that I loved it and just started documenting the things that were working and the things that were not working. I happened upon a company that was just starting out and they hired me on as doctor number 15. And I just had all of these really annoying questions, right? Because I had kind of dabbled in it in real life and practice. And we were broaching the subject of telehealth. But it was really the Wild West when I started, right? You could get online, you could say whatever the heck you wanted, and it was telehealth. So really started getting towards learning processes that worked well for everyone involved. How does this work well for the pet? How does this work well for the clinician? How does this work well for the pet parent? And started documenting and building those processes from a quality and a compassion state of mind. As I went on and grew throughout that company, started learning more about the business aspects of what we were really trying to do and how to run a hospital and how to integrate telehealth and telemedicine into a healthy practice. I'm currently Chief Veterinary Officer of Fuzzy Pet Health, which is all telemedicine, all telehealth, depending on what state they are in the US. And, it's really about bringing those learnings from myself doing around 15,000 interactions with pet parents remotely, and learning from my team as well based on their interactions. So under my team's collective belt, we've got well over 2-3 million, 2.5 million. I think was the last time we did a rough calculation of these interactions and learning from what pet parents really need, what pets really need from us, and what works well for the clinicians and the veterinary technicians, veterinary nurses.
That is, there's so much to dive into there, Dr. Sharice. I mean, from the very beginning, coming out broke from vet school, that's a very familiar story. I agree. I've always worked in clinics where we do our own after hours work. And I think that does, from a veterinary growth point of view, I think that is an important part of things. I have to say, I do struggle to get up at 2 o'clock in the morning when that phone goes after having done it for 16 years or so. But hey ho, that's the career path we choose. But so telehealth, I mean, we think of that as it's a bit of a buzzword amongst the profession, and I think more and more pet parents are being introduced to it, but it's not a new thing. It's maybe grown recently, but I guess it's thought of maybe as a new, all singing, all dancing, shiny service that we offer, but it's something that vets have been offering for a long time in one way, shape or form, isn't it?
Oh, it's the way we built the relationships that we've have, right? As veterinarians, we've answered those calls, we've answered the text messages, we've wrote letters back and forth before there was email about, if they were too far away from the clinic to come. So telehealth is really something that is the hallmark of what it means to connect with a pet parent, with an animal owner, depending on the species that you're dealing with, of course, and meeting them where they are, utilizing their knowledge of the animal or the pet combined with yours. And so this is something that has been going on for ages. We've just now put a nice new shiny name to it.
Yeah, absolutely. And so I guess what kind of different options are there? I mean, you've spoken about, we've got the phone call, we've got the email, we've got the video chat calls. What does services look like at the moment with veterinarians and individual clinics offering this more and more themselves, and also with companies like yourself? What does it look like in its current shape?
Yeah, most of the veterinary practices in the US at least are still going to be very much so focused on what's happening via phone. We got a small glimpse into what it could look like to utilize other methods of technology, especially in the height of the pandemic. But what we've also seen is a lot of that starting to pull back, unfortunately, and that we're going right back to picking up the phone and trying to relay information as best we can in hospital. And I find myself, even when I'm doing locum relief shifts, it's really hard for me now to pick up the phone when I'm so used to being able to say, oh, you know what, just show me what you're talking about. So I actually find myself having to rein in the level of security that I have when talking with a pet parent via video compared to telephone. So now certainly telephone, text message, video message are all things that are on the table as far as that part is concerned. What my team specializes in is online chat. So it's via the app, texting back and forth, text message back and forth with a technician, and then if it does need to get escalated to a veterinarian, getting them to a veterinarian by video so that we can see what's going on. And there are all other types of telehealth. There's teleconsulting, right? So this is when you or I pick up the phone or hop onto FaceTime with a colleague that maybe they're a cardiologist and we're trying to go to bat for a patient that may not be able to get in, or a surgeon when we're in a case that's suddenly something unexpected has happened. Those are all telehealth. It is all towards the health of the pet and utilizing technology to do that. So it's really anything is game. Anything that is not face-to-face, hands-on the pet is actually considered telehealth.
Yeah. And and you also mentioned there that, sometimes it's technicians that have been trained in this field that people will be talking to, but there's the escalation potential. So when people are, I guess, first directing a query, do they have to be concerned about who they're talking to, or what kind of, who that telehealth provider is? Is there some, kind of buyer beware, if you like? Is there regulation about what can be done from that side of things?
Regulatory wise, there's not much. We've seen the American Veterinary Medical Association and largely the veterinary state boards kind of steer away from even the topic of telehealth, other than saying, don't do it in some places. Yeah. Where they actually are missing the opportunity to really relay the level of quality that can happen, right? And so it is a bit buyer beware, unfortunately, in that there are some places that their doctors or technicians or their veterinary nurses may not be technicians at all. They could be veterinary assistants, right? And so you do have to certainly be careful. And that's not to say that veterinary assistants aren't knowledgeable, but you can have that title and be 20 years out or 2 months out. Yeah. And so it does depend a lot on how that company structures their team, or what the veterinary clinic themselves is. Many are struggling to get good, consistent help. They're willing to bring on people that are less experienced. For my team, we do only licensed, credentialed veterinary nurses or technicians and licensed veterinarians. So you do have to kind of do your research as far as from a pet parent point of view, who am I talking to? The other part that I think is just as important, while the veterinary nurses and veterinary technicians are honestly just aces at being able to client communicate, they also are really great at knowing this is not something that a technician needs to be talking about. So we utilize the idea of, gosh, my pet has diarrhea. Cool, that's not a problem. technician can talk about pet diarrhea all day long, but it's such a different story if a pet parent comes in and says, hey, you know what, my pet actually just got diagnosed with Cushing's. Tell me all about it, right? And then you're going to, anybody, we as doctors want to turf that to somebody else to talk to sometimes, right? Depending on the level of complexity of the case. And so it really does, that ability to escalate the case to a veterinarian when it's appropriate is also really important. There's kind of two rules that we go by. The first is if a pet parent wants to talk to a doctor, we get them to a doctor. It doesn't matter if it is, that's a nipple, not a tick. Can be the simplest question to the most complex of, you know, my pet has had a pacemaker put in and I have questions. If they want to talk to a doctor, we get them to a doctor. That's not to say that there are plenty of these conversations, again, that our veterinary nurses are honestly sometimes better than the clinicians themselves at answering the questions.
Oh, absolutely. I mean, some topics, you know, I absolutely direct people to my nurses because they are used to hearing and they'll hear different problems that people will tell them rather than me. And they're used to having these conversations and building the relationships and yeah, they're worth their weight in gold. Absolutely. So I guess 100%. We've spoken a lot about kind of what telehealth is and, you know, what people can expect there. But nothing really about what the benefits are, because there are huge benefits to the pet parent and also to the pet as well. So how do you see that? Because I think there's, you know, there is a bit of a reluctance amongst the profession as a whole, and more people are embracing this as an option, having kind of dipped their toe in the water during the pandemic. But, you know, there is that reluctance, but I think it's easy to lose sight of the benefits that it does provide when we think of only the potential scary things that can happen, albeit very rarely.
Yeah, I think that's a great call out. And I kind of separate it out into three categories as far as the benefits of telehealth. The pet or the animal, depending on if it's not actually a pet, the pet parent or the animal owner, and the medical professional that is seeing the calls and working in the consultations, because there's benefits to all three. So for the pet, we'll talk about primarily small animal because that's where my wheelhouse is for the most part. This is going to be something that we're allowing that pet to have a voice in what's happening with them. Their pet parent knows what they're seeing, but may not always be able to interpret that. It's the very classic, hey, doc, I'm coming in. My dog is limping, but he's not painful, right? It allows us to lend that voice to the information that the pet parent has. And often it's that voice, that level of advocacy that is so important for the pet. But you know what? Vomiting once may not be that big of a deal. But if it's vomiting once and the gums are white and it's fallen over, that's a whole different set of, it's a whole different story. And so it allows us to give voice and give credence to the things that are happening inside that pet, so that the pet parent knows better on how to read it, how to understand the things that they're seeing and interpret it more clearly. So from the pet parent side, there is this sense of honestly being quite alone. Like if you're up at 2:00 in the morning and this little furry critter that you love is having a hard time, there is an immense feeling of being alone. And I liken it to when I was a new mom, human mom, and they've sent me home with this little person and it's crying and something is clearly wrong because it's making it sound like it's the end of the world. What the heck am I supposed to do? Do I try and give them something that helps me feel better, i.e. a human medication, or do I go to the emergency room because it feels like this is an emergency? And so what we have carved out is this ability to calm if there is a sense of that is needed. Hey, you know what? Yes, this is actually an emergency, but you get time to take a deep breath. Here are 3 things that you can be doing right now to help your pet feel better, even in an emergency, to help them get to the next stage of whatever their care looks like.
Sure.
Or it's actually, you know what? This isn't an emergency. Go back to sleep. Be prepared the next day to start calling vet clinics to see if that's a place that you can get into. But this actually isn't an emergency. We can save those emergency dollars towards more total care for that pet in the long run. And that's just kind of the acute aspects of it. The other part that I really love about the benefits to the pet parent in telehealth, especially kind of how we do it at Fuzzy, is this everyday wellness component of you don't have to guess anymore. That's the part for me of like, oh, is that a cut? Do I wrap that up? Do I leave it alone? Am I supposed to be feeding this or that? All of those sorts of those daily decisions that we wish we were in the pet aisle to slap a food out of the pet parent's hand and go, no, that's terrible. Don't feed them that. Well, we get to be that, that we can literally have people on video with us as they're walking through the pet food aisle and saying, oh, is this a good option? It has a dog that looks like my dog, right? And then we get to have the conversations of, well, actually, you have a puppy and this is senior food and this is why nutritionally this is not going to align with what your goals are for your pet. And so it allows them to help to make the right decisions on a daily basis rather than just the acute. The third is my favorite because it's one that we actually don't talk about nearly as much, I think, in veterinary medicine. We have this, what we're calling a shortage, and I do believe that it is a shortage. It is a shortage of veterinary nurses. It is a shortage of veterinarians, and regardless of kind of other entities that may say otherwise. But the beauty of my team is that we have these brilliant service-minded veterinary professionals that for whatever reason are either not capable of continuing to work in hospital, is a back injury or an autoimmune disorder, or they have 4 kids and now they have to make decisions about how they're going to lead their lives, but are absolutely still willing to serve pets and their families. There are ones that are absolutely just burnt out of the traditional methods of medicine. And so instead of having those clinicians leave our field, we're able to give them a place where they can still communicate with clients, but maybe they're not talking about a bill. Maybe they're not getting up at 2:00 in the morning unless they choose to, because we're 24/7, to have to answer those calls.
Yeah.
And so I think that there's that aspect of it as well that's often ignored. It allows us to not just pull moms out of the workforce if they want to work during maternity leave. This gives them an option because often, at least in the US, maternity leave is unpaid. Yeah. And so you have all of these combining factors of if we utilize telemedicine and telehealth to its full potential, the pet absolutely benefits. We were able to intervene before the animal is actually suffering, especially in these everyday wellness cases. The pet parent, and that they're not alone in making these really difficult choices for these critters that they love. And then third, for these clinicians to allow us to take a breath and to reclaim our colleagues back to the field that they love.
Yeah, we're not losing their expertise and their dedication to helping their patients, to some completely different field, which I think is something that people can, pet parents might think, well, sure, I kind of sympathize with my doctor or feeling a bit burnt out, but it doesn't really make much difference to me, which isn't the case because we are in a shortage. And I think, that's recognized across the world, no matter which country you're in. And I'm hearing again across the world that wait times they're really building up. You're talking 2 weeks plus to get any kind of consultation unless you're dealing with an emergency situation. And that's where telehealth can then step into that gap to provide that reassurance to say, well, your pet needs to see the vet, but it doesn't need to be now.
It doesn't have to happen now.
It doesn't have to happen now. And that after hours, that emergency care, like you say, those, and quite justifiably, those costs can be tremendously high. And if it's an unnecessary visit, then, that money's better off in the pet parent's pocket or to be kept for a rainy day or for further investigations as needed. So it's a win-win from that point of view. Dr. Shreves, I'd love to talk also about kind of accessibility of veterinary care, because I mean, that's kind of part of it. But telehealth, there's a huge number of pets in the US and across the world who don't ever see a vet in the traditional sense of the word. There's also a problem, I guess, within the profession with representation with, from traditionally it's a white middle class people are the vets, and that doesn't reflect the population as a whole. And, that maybe causes people a reluctance to visit the vet as well. So telehealth, I think, plays a really important role in providing care for pets who may not have access in the traditional sense of the word.
Yeah, and I think that access, often what people think when we start talking about access to care is, oh my gosh, these are all pet parents that are socioeconomically, they can't afford to take care of their animals, right? That's not always the case. We are inundated on a daily basis with pet parents that have the means to go to a vet clinic, but maybe they don't have a car and they can't get their pet on the bus, or they can't take off work because their paycheck is directly tied to feeding their family. There are all sorts of these reasons why access is important. It's not just the socioeconomic or the demographic aspects of it. But to your point, absolutely, there is very well documented, especially in human medicine, distrust in clinicians that don't look like you. There is a learning curve for, just cultural humility of what are things that are normal in one culture that may not be normal in another, especially around pet care and how they're treated. All of those aspects combine to, if I don't feel like I'm going to be understood by a clinician, or I feel like I'm going to be judged by that clinician, why would I bother to go? I'll just try my best here for this pet. I will tell you some of the most rewarding telehealth experiences that I've had is I'll get on and it'll be a family of color, a Black family. And they look at me and they go, are you the doctor? And I'm like, yeah, I'm the doctor. And, there's kids in the background, all sorts of things. There's much like at my own house. And she just lit up and she calls her son over. And I mean, if you're talking about the smallest population in veterinary medicine is Black men, right? I mean, we're talking less than 0.3% of the population of veterinarians is a Black man. And so she calls her kid, has nothing to do with the telehealth visit at this point. She calls her kid over and she's like, I want you to meet Dr. Roth. He really loves animals, and just there's this ability for us to open our doors as a field to these families to show that, number one, there are veterinarians of color. They're not nearly enough, but that they're there. And that also helps in longer terms with that veterinary shortage. That if we want to see things we've never seen, it's one of my favorite quotes, we have to do things we've never done. And that means recruiting in places that schools don't recruit, right? That means having colleges look in places that have dedicated individuals that love animals that may never actually be able to get beyond the barriers to getting into veterinary school. And so with telehealth, you're able to align suddenly these clinicians with pet families that may never have interacted with a veterinary professional before in their life. But because most people, even our homeless members of Fuzzy, have access to a cell phone, be it prepaid or otherwise. And so they now have this ability to access someone that cares about that animal or that pet just as much as they do. And then helping based on where they're at and how they live to best help that pet.
Yeah, that's fantastic. I mean, that's such a powerful thing. And what an amazing experience to be at the other end of that call as well, to be inspiring the next generation potentially, or just to help spread the word that actually, there is care available no matter who you are and where you are in one way, shape or form. So with regards, because we've spoken about talking about, triaging calls, I guess, is, we need to go to the emergency room or you can wait. What are the limitations in actually the care that you're able to provide from a remote basis? And I guess I'm talking more about like the prescription of medications and the diagnosis of problems, because I imagine that's going to maybe vary by state, certainly by country, because I guess one thing that I've seen in comments made, well, I'm going to, if I just call the telehealth, they're just going to tell me to go to the vet anyway. So, I'll save that $40 or whatever it is for the actual vet visit. Clearly we've kind of touched on why that's not just the case, but what are the limitations or what are the rules around that kind of diagnosis prescribing aspect of the role that we do?
Yeah, so the biggest limitation, you hit the nail on the head, is the veterinary medical boards, and either they have not taken a stance on whether or not we can form a veterinary client-patient relationship, or they have just vehemently said, no, you cannot do it, with no explanation or no room for discussion. So that's hands down the biggest barrier for these pets getting care. No bones about it. Telemedicine wise, we kind of, the way that I kind of talk to my team about it is that our expertise ends when a needle or a scalpel is involved. It's just that simple. So there are no cases that we're going to shy away from discussing because this is all about the life and the total health of that pet. So we're there in those triage cases, but we're also there in those everyday wellness aspects of how to keep that pet healthy. Happy days. In the same breath, I can also say we're not doing internal medicine workups via telehealth or telemedicine, right? These are the cases that are simplistic. Anybody, most people in the medical field can look at a pet and go, oh, that pet has fleas. And if you're savvy enough and you are a veterinary nurse or you're a veterinarian, you can look at the pattern of the hair loss and go, oh, your pet's losing hair because it has fleas. And so we're talking about these cases that are often, more often than not, ones that don't actually need a clinician to put hands on them. So this is diagnosis of atopy. This is pets that can't be touched. How do we talk through behavioral pets that, from a fear-free standpoint, can't walk into a clinic until they have gone through the full chill protocol and are allowed to chill out, right? To even get to the point where we can provide care. We're talking about, hey, my pet just got diagnosed with diabetes. I totally checked out as soon as they started talking about doing injections.
Yeah.
What the heck does any of this mean? So there's this whole gamut of what's able to be done. The biggest things outside of the veterinary boards, we shy away from controlled substances, as you can imagine, things that have a chance to be abused by the humans, which honestly, there's not many that happen that way. In cases of like anti-seizure medications, those are going to need some level of blood work to figure out why the pet is having seizures. And so we get this opportunity that if it is something that's, well, actually, this isn't something that for my own pet I would prescribe remotely for. Here are the best next steps for your pet. That if it is something that we do need diagnostics and it's not a home diagnostic, that we're able to get out to them. So we can send out heartworm tests. We can send out feline leukemia tests, fecals, skin and ear swabs, those sorts of things to get a pretty good picture of what's happening within that pet. But if it's something that requires ACTH stem test, CBC to figure out what's going on, parvo tests, then we're able to lay down and lay out very clearly the value of why that diagnostic is so important. So when they come into your clinic, Dr. Alex, they are prepared. They know, what, I do need to spend money on this and it may be expensive, but I also know that this is going to let us know if it's diagnosis A or diagnosis B, and that's going to help them to be more compliant and ultimately adhere to the therapy plan and the diagnostics plan that you have in mind for them.
Yeah. And I mean, that touches on something that's very important in the sense that it's very common that you hit someone with a potential diagnosis, you say a particular word like diabetes, and everything else that you say after that is, it goes straight over the head, because just that internal dialogue of, well, what does this mean for me? How am I going to be able to cope? How are my pets going to be? That just takes over and everything else is forgotten. So we're kind of valuable partners from that point of view, because we can have this explanation without then needing a separate trip into the clinic. Or if you've had that discussion ahead of time, that's, it's really powerful. And then those cases that you are able to help, a lot of those are kind of our bread and butter, or, they're our daily, kind of not catch-up consultations. That sounds really dismissive, but they're pretty quick to deal with when we're having a hands-on, your cat's itchy, flea comb goes through, here's fleas, here's some bits and bobs, here's how we can get rid of that infestation, off you go. It doesn't take the full 20 minutes sometimes.
Yeah, but I think that's a call out there though, right? And that from an operational standpoint at the hospital level, you would much rather replace that visit with a pet that actually needs your hands and needs your skills.
Absolutely.
Needs a needle, needs a scalpel, right? And it's not because of necessarily a revenue standpoint. It's not making more money. It's the aspect of what pets need us the most. It's the oath that we took, right? It is, how can I help keep this animal from suffering? How do I better the lives of the people that it's involved with? And then is there a public health implication here? And for those sorts of things, it is absolutely, I would trade out any day a pet that, let me diagnose you with fleas in the room versus a pet that could have a major GI parasite or something along those lines that could pass to their people, right? So I would trade those
in a
hands down
heartbeat.
any day.
Yeah.
Yeah, absolutely.
Especially in
And
the
so we
current
pull
climate
those
where
up.
those waiting times are longer. And, I guess we've always, as a profession, certainly everywhere I've worked, you've kind of prided yourself of being able to fit everybody in the day that they call, no matter what, we'll squeeze you in, but that's becoming just impossible. So yeah, let's trade out some of these ones that can be dealt with remotely very successfully for some that absolutely do need the hands-on and that diabetic diagnosis or what have you. When it comes for people to get the most out of telehealth, and I guess a lot of this will probably go down to getting the most out of a visit to a vet in general, what kind of tips have you got for people to get the most out of things, so that they're not just hit by this one word and then forget everything else that they were saying, or maybe so that they can provide the best information to get the best outcome for their pet? What top tips have you kind of come up with over the millions of interactions that you and your team have dealt with?
My favorite is have the pet present.
Yeah.
As simple as that sounds. But there's often a lot of questions that we can get just by observation, right? And so those sorts of things, I think that's number one. Have the pet with you while we're having this conversation, because then we can say, hey, what color are the gums? What do they do when you flex their elbow? All those sorts of things, so that it helps to again, allow us to advocate best for the signs that the pet parent is seeing. Some of the others is, at least with Fuzzy, it's unlimited interactions with us, no matter how many pets you have in the family. It's all one. And so that would be another thing, the kind of buyer beware. Make sure you know what you're paying for. But also be watchful of, is it just one pet that's affected, or is it multiple pets in the household that's affected? Because that also helps us to say, okay, this gives us just like in regular clinic, hey? Yeah. And is it just the animals affected, or are the people also affected by what you're seeing? Is everybody in the household itchy? Does everybody in the house have diarrhea? These are things that we would want to know. As you know, people will share with us. So I would say that. I would also say being in an area with good internet is one that, at least from a telehealth standpoint, for chat, it's not so vital, but definitely for video, it's, as we work through kind of what good medical quality looks like, removing technological issues is a big plus for us as well. And the third would be come with an open mind. We have really funny ways of asking the same questions so that we make sure that we know exactly what your pet is going through. And so sometimes that does mean, where you could say in the clinic, oh, I see fleas, I see the larvae. We may ask you, hey, what happens when you rub your hand on your pet? We may have to ask more questions to get to the same endpoint. So being prepared, having dedicated time for the visit, I think is part of that. That makes it really successful. Yeah. The other thing that's kind of it'll be a little asterisk. Be open to being able to provide your veterinary board with feedback. And I say this because there are great telehealth and telemedicine interactions happening. And as we talked about, some of the barriers of, I know this pet is painful, but I cannot give it an NSAID because it's against the law in your state. Being willing to go to bat for your pet because of those things is, I think, at the level that we're at now of, hey, you know what? My pet was super painful. The doctor really wanted to help. And she couldn't help my pet with pain because your rules are ambiguous, or your rules say that she cannot do it. So those sorts of things, I also think having an idea, it helps us to manage the expectations too, because it could be the exact same case. And for some cases, if you're in California, you're stuck with, hey, give this bland diet, do a probiotic, which is often enough. But if it's not enough, I need other things that we can do to be able to help that pet. And so I have no doubt that pet parents, and they continue to do it, being that voice of the consumer, because that is the job of the veterinary boards, is to protect the consumer and to give them what they require of their clinicians.
Yeah. And I guess a lot of these legislations and things, they are historic. They're based on historic technology. The letter is very hard to diagnose and have a back and forth conversation compared to the video call, isn't it? So, I think we need to adapt to the changing lifestyle of people as well. It used to be that everyone was, single earners in the house, and you had, stay-at-home mums who, and kids at school, and had time to go to vet clinics potentially in the day. But now, we've extended opening hours, so it's more accessible to people from working patterns. There's all kinds of different things that we need to adapt to as well as a profession. And I guess this is one, very important one that people are becoming more familiar with their own care as well. So, why not for our pets?
I also think that there's in some cases it's not every day that this happens, but there are things that we can catch via telemedicine that we can't catch in clinic. So for example, these pets that we can't put hands on, we can actually get an oral exam done because they're at home in their own environment. We have found oral masses on cats and dogs. We have found foreign bodies in the roof of the mouth because the pet was calm enough for us to be able to walk that pet parent through the entire digital physical exam. And so there's those aspects of it as well, of actually being able to put hands on things that we could never actually do in clinic. The other are the behavioral catches that we know that our patients, especially cats, can hide things like none other. And so we actually get like real lameness exams on cats.
Yeah.
Like actually see a cat limping. It's this.
It doesn't happen, does it? They never do it in the clinic.
No, it never happens. But we're able to see those things and document it. And then if it's in a state that we can treat, great. If not, then we're relegated to sending out the soap to their clinician or whoever we're referring them to, basically co-signing and saying, yes, this pet actually, we saw a grade 2 lameness. This is the paw that it's in. There's no way you're going to see it in the clinic, but so some of that you have to kind of just believe the telehealth provider.
Yeah.
But there are definitely cases where the telehealth is actually a higher quality of medicine than what can happen in a consult room.
Yeah, I can completely understand that with so many different things. That lame, like you say, the lameness, the lame dog who comes in who is absolutely sound in the clinic because they're stressed and the adrenaline's up and they're just not going to show signs of any discomfort, even on manipulation. And okay, then you can maybe painkillers and rest and they'll come right. But to see that lameness can be very important if it's a progressive problem, for example. So Dr. Charisse, this has been an amazing conversation, diving deep into lots of, we could have dived deep into even more avenues, but our time is up for today and I'm mindful of your time. For people who love the sound of this, who think it will work for them, or even just want to have it in their back pocket, should the need arise, where can people go to find out more about, the work that you do yourself and Fuzzy and other kind of telehealth aspects? Where would you like to send people?
Yeah. So I think the easiest way is just downloading the Fuzzy app. It's on Android, it's on iOS, and that gives you a really good comprehensive view of what we do, how we help our pets, and how we help your pets. Other than that, obviously there's social media. I am now on TikTok because that's a whole thing. So at that Dr. Roth, underscores throughout the word. So at _ that Dr. Roth. And it's, full of these kind of things of giving actual cases of telehealth and how they can be helpful. You can find me on Instagram at charisse.roth, any of those sorts of things. And I think that while I am partial to how Fuzzy does things, because we treat our patients how we treat our own pets. There are lots of good telehealth providers. I think the key differentiator is that while the majority of them are there for this kind of teletriage, go to the vet, not go to the vet, that the thing that makes what Fuzzy does so special is that we really do get involved in the life of that pet. It's journaling for that pet. It's tracking how they're eating, pee and poop, medications being given on time, all of those sorts of things that make it a bit different.
Fantastic. I love it. Dr. Charisse, thank you so much for your time. It's been an absolute pleasure to talk to you again today.
Oh, thank you. Thanks for having me. I can talk to you all day.
Well, same. Well, we'll maybe talk a bit more off air, eh?
Helping your pet live the happy, healthy life they deserve.
I'm so pleased to have been able to bring you this discussion with Dr. Charisse. I think the field of telehealth and telemedicine is a really exciting one. I think it's easy to get carried away with technology and doing things for technology's sake, but I think it's such a powerful tool that is really in its infancy in terms of uptake, if not technology, that has a huge potential impact on every single pet and every single pet parent out there. So really looking forward to seeing what the future holds with this. Also, you can check out Fuzzy over at ourpetshealth.com/fuzzy. That's FUZZY. And there'll be a link down in the description. If it's something that interests you to dive deeper into, I definitely encourage you to check out Fuzzy. Remember too to subscribe and follow the podcast so that you don't miss out on any of my future episodes. And until the next one, I'm veterinarian Dr. Alex. This is the Call the Vet Show, because they're family.
That's it for this episode of the Call the Vet Show. Be sure to visit callthevet.org to join the conversation, access the show notes, and discover our fantastic bonus content. We'll see you next time.